Adolescent neurodevelopment. Adolescence is a critical time for laying the foundation for health and well-being in adulthood. However, this is also a time when we have the highest appetite for risk in our lives, are more susceptible to peer pressure, and think in the present. Good health advice is what teenagers need to help them steer successfully through this particularly difficult phase of life, but this isn't easy. Their thought process is different. 70% of young people with a mental health problem do not get appropriate interventions at a sufficiently early age, and they will often present with physical symptoms. More than 50% of young people with a mental illness are embarrassed by this diagnosis. Teenagers need support to help them with sensitive conversations with their GP. Teen Health Talk helps you provide this support and to make every contact count. The need for Teen Health Talk. 70% of adult preventable deaths are the result of behaviours initiated or reinforced in adolescence. For example, 80% of lifetime cannabis and alcohol use is initiated by the age of 20. 50% of lifetime mental illness starts by age 15. 8 out of 10 obese teenagers become obese adults. And 8 out of 10 adult smokers start as teenagers. It doesn't have to be like this. Early intervention through good communication can significantly improve the health of adolescents in your community now and throughout adulthood. Teen Health Talk has been developed by GPs for GPs to help with their consultations with young people. Statistically, adolescents get shorter consultations with their GPs than adults. Teen Health Talk has been developed as a conversation aid to help teenagers discuss their problems with their GPs. Young people and confidentiality. Young people rate confidentiality as one of the most important aspects of medical care. Concerns about understanding the limits of confidentiality can inhibit teenagers from properly addressing medical issues at key stages in their lives. Teenagers must feel able to trust their health professional, and Teen Health Talk helps to build this mutual trust. Teen Health Talk helps the young patients to understand what confidentiality means and how it works for them in the context of a medical consultation. Offering ways of providing this reassurance is a strength of the template. Top tips: use of Teen Health Talk. The Teen Health Talk has been created by GPs. It creates conversations using prompts that will help you to assess young people's vulnerability by developing a greater understanding of their needs. It can support a health professional to really pick up on underlying health and social factors, and helps to make conversations about sensitive issues such as sex and drugs easier. Here are some of the prompts and how they can help you. Home. Find out about the home circumstances. Don't make assumptions about where they live. Ask where they spend most of their time. Education and employment. Are they in school or at work, or have they dropped out? Activity. Have they stopped doing things they previously enjoyed? Drugs. This can be a difficult conversation. It may help to say, many young people experiment with smoking, alcohol and drugs. Prompts can help. Have you ever tried any of these? If so, how much and how often, and is it a problem? Sex. Are they sexually active? If so, is it consensual, and do they practice safe sex and use contraception? If they're comfortable in discussing it, find out what their sexual orientation is. Screens. Do they spend an unhealthy amount of time using electronic devices? Sleep. Does the young person get enough sleep, and if not, why not? Are they anxious, stressed, or low? Self-harm, suicide. If they have low mood, look for signs of self-harm and suicidal tendencies. Safety. Does the young person feel safe at home, at school or college, and out and about? Consider any risk of bullying, domestic violence, or gang affiliation. Teen Health Talk encourages and supports trust, leading to greater understanding of underlying issues. It helps to maintain continuity, bringing issues to the surface and facilitating follow-up. Remember, a young person's priorities are not necessarily the same as an adult's. Adult rational behaviour is not always possible. Don't underestimate the influence and importance of peers. It's important to be empathetic and non-judgmental with young people and to explain confidentiality. Always ask for up-to-date contact details. Teen Health Talk is coming to your practice soon. helping you to help teenagers.